This is the recording for the Occupational English Test, and the test is held at Medcity International Academy, Kannur on 8th March 2023. The candidate's name is Shyam Punon and the candidate number is 542398. The interlocutor is Roshni and the interlocutor number is 368145. This is role play number 1 for the profession of nursing. Good morning, Shyam.
Good morning, madam.
May I see your identification, please?
Of course. Here you go.
Okay, thank you.
Thank you.
This is a test of your English language and not an assessment of your professional knowledge.
Okay.
Keeping that in mind, speak as you would naturally.
Okay.
We will move on to a warm-up session to get you started.
Okay.
This is not in any way assist. Okay, Shyam, tell me, why did you choose to be a nurse?
Well, my mother used to be a nurse before she decided to retire and become a stay-at-home mom. And I've seen her help a lot of people. She's had difficult nights and she's had some easy nights. I've seen her cry. And I just thought, as her son, I think I should do something on that same level as she has done.
Okay, great. And what do you think are the qualities that a nurse should have?
Well, what I've learned from my mother is that no matter what the conditions are at work, whether it's a good day or a bad day, you should always be able to empathize with the patients so that you know how they feel and you would be able to react accordingly.
Okay, great. Now that's the end of the warm-up session.
Okay.
Let's now move on to the role play.
Right.
I'll be taking the part of the patient or a relative perhaps, and you take the professional role.
Okay.
The role play will last a total of 5 minutes and you'll be given 3 minutes to prepare for the same.
Okay.
The role play intends to get evidence of your ability to perform effective communication with the patients. Do you have any questions?
Not at the moment.
Okay, fine. So you'll have 3 minutes to prepare for the role play. You can make notes on the role play card if you wish to do so. Here is a pencil and here is the role play card. You can look at the card during the test, but you must return it to me at the end of the test.
I will.
So your preparation time starts now.
Okay.
Okay, Shyam. So that's the end of your preparation time. The role play will last 5 minutes and don't worry if I stop you when the time is up. And you can begin your role play now.
Okay. Good morning. My name is Shyam Punon. I am the nurse on duty today. May I know your name?
I'm Pat Collins.
Okay. Ms. Collins, what brings you to the hospital today?
Well, I'm here with a problem regarding my daughter. She has been experiencing asthma-like symptoms for the past few days. And that really bothers me. I'm really worried.
Okay. What is your daughter's name?
She's Jody Collins.
Okay. And how old is she?
5.
5 years old. All right. Okay. Could you tell me a bit about the symptoms that you've noticed in Jody?
It started off with runny nose and she had sneezing, normal colds, normal flu kind of symptoms. Then it progressed to coughing and wheezing. And it looks like asthma to me. So I'm really worried.
Okay. Don't worry, Miss Collins. I can help you out with this. Could you give me a little bit more information? What place are you living in right now? What kind of living conditions?
We live in an independent house. We have a good neighborhood with park and things like that and the surrounding. Yes.
Okay. Okay. And Jody's eating habits. What does she like to eat? How often?
I believe that her eating habit is very healthy. She mostly prefers home-cooked food and she takes her food adequately.
Okay. And have you noticed any change in her behavior or what kind of behavior pattern have you noticed in her?
Well, she's generally a happy child and she's very social. She likes going out and playing with her friends. Very calm and quiet. Yeah.
Okay. Thank you, Ms. Collins, for sharing all that information.
Yeah.
Do you have any carpets or rugs in the house?
Yes, why did you ask that?
Medcity OET app. Learn OET listening, reading, writing, speaking, and OET related grammar at your own convenience. Download the app now.
Well, there could be a possible reason connecting this to your daughter's condition. How do you maintain these these carpets or rugs? Do you clean them often?
Yeah, I regularly give them for dry cleaning. In fact, every month I'm very particular about that. So I don't think that could be the reason for this.
Okay. Do you have any pets at home?
Yes, we do have.
You have a pet at
Recently,
home.
we bought a dog, 3 months old dog,
Okay.
and we are all very much attached to it, in fact.
Okay. So have you noticed the symptoms in your daughter after you got the dog home?
Yes.
Okay, I'm so sorry to tell you this, Miss Collins, but there is a possibility that it could be the dog that's causing these allergic reactions
Oh,
in your daughter.
that sounds very disappointing.
Don't worry, I could suggest a few ways you could manage this.
Okay.
Okay,
Yeah.
unfortunately, medication will not work at the moment for your daughter because it's really clear. It's vivid that it is a dog's hair, it's the fur that's causing allergic reaction in her.
So, what are you trying to say?
What I'm trying to say is you would have to think about removing the dog from your home environment, separating your dog from your daughter.
Sorry, I think that would be next to impossible for me because my daughter is so attached to it and she wouldn't be able to accept it. What about these anti allergic medications? You
Well,
don't have any such remedies?
well, we could try to give her some uh, antihistamines to keep the conditions at bay.
Yeah.
But as she's allergic to animals, there's a possibility that you'd have to go long term with this. And the better option to do right now, instead of putting a young child on medication like this, is to think about the ultimate option, which is to remove this new member of the family from the current environment and keep your daughter and it separated.
Okay. So, are you very sure that like there are no other alternatives for this?
Not at the moment, Miss Collins.
Okay.
I think that your daughter is definitely allergic to a few animals, at least, and it would be better to keep her separated from animals for the moment.
Okay. If that's the case, then like I'll have to think over it.
Yeah, I
Considering
wish.
my daughter's health, I'll have to do that.
Yeah,
It is a bit difficult for me to handle, but yes, I'll have to think over it.
yeah, I totally understand that your daughter and the new pet, they must be inseparable because
Yeah.
animals are really attached to
Yes,
human
yes.
beings, and human beings are really attached to animals. So
Exactly.
separating them might be difficult, but for her own health and her own safety, this would be the only possible thing that we could do right now. And I hope that you will do it. So you will definitely be able to notice immediate relief.
Okay, Shyam, that marks the end of your speaking test. Please return the role play card to me.
Sure,
Thank you very much.
you're welcome.
Download Medcity OET app, available on Play Store and App Store.